Welcome to the Sacramento County podcast series, County Conversations. I'm your host, Kim Nava. Today, I'm here with some very important members of the county's Division of Public Health. I will let you all introduce yourselves and your role, and I'll start with Dr. Olivia Casserier.
Hi, I'm Dr. Olivia Casserier, County Health Officer.
My name is Megan Sheffield. I'm a Human Services Program Planner, and I work for our accreditation unit.
And I'm Gerline Roberts. I'm a health program manager, and I oversee the accreditation unit.
All right, great. Well, thank you all for coming in to speak about your division today. We're really happy to have you on the show. Now, public health recently earned national accreditation from the Public Health Accreditation Board. So tell me, from your perspective, what does it mean for a public health department to be accredited, and why is that significant for the county?
Well, thank you so much for having us here. It's a really exciting achievement for public health. We've been working on this for quite a while, many years.
Yeah. How many years?
We actually started working on it in 2012, but in 2018 is when we started working on the documentation.
Yeah.
And then, of course, we had to stop because of COVID.
Something happened.
And now we're back. We started again in 2022, and so 24 we finally completed the job.
All right.
Yeah.
Well, tell the audience a little bit about accreditation. What does that mean? Why is that significant for a public health division to get that accreditation?
Public health accreditation is a national program that is led by the Public Health Accreditation Board, a national board that is supported by the Centers for Disease Control and Robert Wood Johnson. And basically what the process is, it's a process where our documentation, our policies are reviewed against a set of standards, 10 standards. And it's quite a lot of work. We have to set certain policies in place, such as community health improvement plan, community health assessment, and a lot of different policies that have to be set in place. And we have a team that comes in from the Public Health Accreditation Board that then reviews all of that and then lets us know if we meet the standards or not.
All right. And we got the great news in November, right, that we'd had that accreditation. What were some of the biggest challenges the team faced during the accreditation process, and how did you all overcome them?
Sure, I'll take that one. So like Dr. K said earlier, we did start the process before COVID, and it kind of fell on the plate of staff that had other responsibilities. And so after COVID, the Board of Supervisors approved us to have 4 dedicated staff to collect the documentation. And so that challenge of staffing dedication was resolved. And so that was really great. And then one of the other things is that because some of the documents and processes we started updating before COVID in 2018 and 2019, in 2022, the Accreditation Board updated the standards and measure requirements based on the pandemic response, which is great because they're trying to be more reflective of current needs. But that kind of forced us to go back and update a lot of the things that we had already started. And so in the end, it turns out to be really great. But it took us a little bit longer because of that.
Sure. Yeah, understood. So how did teamwork and collaboration play a role in achieving this milestone? For instance, were there any key community partnerships that stood out for you in your role?
Absolutely. So part of accreditation is really taking a lot of different pieces and putting it all together in a package. So we had, as Gerline mentioned, our group of 4 who really, our job was to read each standard and measure and determine what we thought the best documentation would be to prove our excellence in that standard. But what that means is that we really have to pull together every program that we have in public health. So while we have an accreditation unit, we were just responsible for the documentation piece, which was big, but we're really relying on the massive amount of work that all of our public health programs do and how they are able to work with communities and put together documentation, how they interact with their clients, what kind of feedback they receive from their clients, all of these different elements come together to show that we meet these 10 standards that Dr. K was talking about. And so there's a ton of collaboration that happened within public health and within our team. But in addition to that, we really do have to work with our community members. And that's in the documentation that we have, but it's also, they came to our site visit. We had 10 community partners come to talk to the FAB site visitors and to really talk to them about how they see their relationship with public health and what they found to be meaningful about working with us. And that was really heartwarming, I think, for us to see, to have this group come in and be able to talk about how they like working with us, what they see in their communities, and that they really do want to move forward alongside of us doing this type of work for the next few years. And so it was very nice to have that group come in and be able to share with the site visitors what they see happening in our community and how we can all work together.
That's really good. Could you give some examples of public health programs, maybe for listeners who aren't familiar? Like, what are some of the public health programs, services offered?
Absolutely. Yeah, we have, I want to say close to 30, maybe a few more.
That's why I said a few examples. You can't say all. You can't say all of them.
Exactly. So we have some that operate in sort of a nursing. Some people might think about public health nursing. So we do have our immunization assistance program. We have a communicable disease program. So that nurses that might come into your home to assess a newborn baby. We have a nurse family partnership program. We have a lot of nursing programs. And then we have some health education programs, so tobacco education, nutrition education, and active living. We have sexual health promotion programs, and we have a sexual health clinic. We have tuberculosis control in our chest clinic. So we really run, plus internally, we have a full epidemiology unit, plus our internal workforce development programs, and we have a health and racial equity unit as well. So.
All right, for another podcast. Yes. We're going to explore all those in another podcast because we could go on and on about those. So thank you for that. Let's get back to the accreditation. So how does that benefit Sacramento County residents? And are there any changes the community can expect to see?
So public health does provide very crucial services for the community in order to protect and promote the health of the community. And I think that came across real clearly during COVID.
Yes.
We were providing a lot of services and providing information about what was happening with COVID. And even now, while we're in the respiratory season, people depend on us to let them know what's going on, what do they need to do, when do they need to get their vaccinations, do they need to wear masks? We still get those kinds of questions. And so I think it's important for the community to know that and have the confidence that the services we're providing actually meet national standards. So I think that us being able to get this accreditation gave that validation that we do meet the national standards and that we do provide all of the services that are expected to be provided through a public health department. And so as far as changes, definitely through this process, we've learned a lot. We've had to implement new processes. We've had to ensure, for example, that all of the programs look at how we incorporate health equity in the services that we provide.
Yes.
And so that has made us relook at the way that we do things. For example, the way that we came up with the community health improvement plan, there was a lot of thought into how do we incorporate the voice of the community, how do we work with the community, how do we continue to enhance the collaboration that we have. And actually one of the questions that we were asked as well, during COVID, you worked on a lot of collaborations with community-based agencies. How have you continued to do that? So we're constantly looking at ways of collaboration, of ensuring that the services we provide actually ensure that we are looking at the health equity angle and that we're providing good services.
Well, you all have been very humble, but I'm just going to say I think this accreditation shows that our public health is the best of the best. So I'll say it if I know you aren't, but I think we can say that. So, what are the key lessons that the team learned during this journey, and how will those lessons shape future public health work?
Yeah, so one of the lessons from COVID highlighted that our public health infrastructure needs to be flexible, adaptable, and we need to support us being resilient. And so, as we were creating this infrastructure and updating plans and policies, we really tried to make sure we instilled the QI process so that there's going to be cycles where things are updated and feedback is collected, and we're using that feedback to update what the current needs are. And so that way we can be better prepared for the future. And then the second thing we learned is that collaboration and equity are key. So we saw that firsthand how engaging staff and other departments, especially EMD and the community partners, it created a stronger, more cohesive system. And so we wanted to make sure that we're listening to diverse perspectives and improving all of the work so that it's inclusive for everybody impacted.
Yeah. Okay, so I'm going to ask a question, and I'll ask for each one of you to give an answer on this. But what does this achievement mean to you and your team on a personal level? And we'll start with Dr. K.
It means a lot because actually when I started in this position in 2012, one of the requests from the Public Health Advisory Board, which is an advisory board that advises the Board of Supervisors, they had written a letter to the board when they knew that Sacramento County was looking for a new health officer. And they mentioned some things that they wanted the new health officer to focus on, and one of those was accreditation. So I felt like I had not completed my job if I had not done.
Yes.
And it gives a lot of satisfaction in terms of seeing just how much we do, because a lot of times we're so busy just getting work done, but being able to see the documentation, just seeing the dedication of the staff, it gave me a lot of sense of pride in knowing just how good our staff are at the jobs that they do.
Seeing those pages and pages, right, literally, of the good work that you all do. That's great.
Yeah.
Megan.
I definitely echo what Dr. Casario is saying. I am personally very proud to work for Sacramento County Public Health. I've been here for over 20 years now. And I've worked in a lot of different programs, and I've seen the capacity of what we have and what our staff are able to do. And I think for a long time, public health has been very happy to just we like to do our work, and we like to just sort of keep on keeping on. And during COVID, we were obviously thrust into a very bright spotlight. And I'm actually proud that we can keep that spotlight and keep going forward and saying we do really great work, and we work very hard to ensure that every resident of Sacramento County has the health services that they need, and that we can provide them with education and resources. And so I feel like this gives us the opportunity to really say we're doing a great job, and to remind our staff that collectively it can be very hard to go through what we've been through and keep on each day. And so I think this was a great time for us to be able to be really proud of the work that we do and be able to show our community partners and the community what a great resource we are.
Thank you. Garlene.
Yes. So I've actually done this accreditation process 3 times with 3 different health departments. And so this time is the most rewarding because it's like, this is where I grew up. And so helping my hometown get accredited has been very rewarding. But also internally, the culture shift that we've seen, like the morale with the staff and our relationships with the community partners, that has taken lots of time and intention, but seeing the culture shift over the last 2 years has been just beautiful. And I do love my job, I love my team, but it's also nice to see like other people enjoy and want to be here too.
That's amazing. Okay, so what is next for the for the Division of Public Health, and how can residents stay connected with your work?
So I think the best place is our website. So we do have, I know sometimes the county websites can be a little bit tricky, but we do have a shortened one. We are scph.com. So, or you can just Google Sacramento County Public Health and we'll pop right up. You can see lots of information like the community health improvement plan that Dr. Caserio was talking about and our community health assessments. Lots of information about every program that I couldn't name, but all of them have their own individual web pages and lots of places where you can get information about the work that our staff are doing. And I think that's obviously the easiest way to get in touch with us, but hopefully more and more on social media and news stories to come about the really great work that our staff are doing.
Well, thank you all for coming in. Dr. Caserio, Megan, Gerline, we appreciate sharing your knowledge and perspective with our listeners, and you all will be back because we want to talk more about public health and what public health provides to residents. So thank you again for that. And to our audience, thanks so much for joining us. We hope you enjoyed this podcast, and we hope you'll listen again as we feature different county department leaders throughout our series, County Conversations.
This podcast is produced by Sacramento County with production services provided by SacGov Studios.